Hi, Dr. Fuentes.
Hi kids, come in. This is Beatrice Berman. She's a medical librarian and she's helping me today with the research.
Hi kids, I hear you get around.
We've been everywhere.
It's been cool. So what exactly do you help Dr. Fuentes with?
I'm helping him find some of the latest information and latest developments available.
You have magazines here? Any Spider-Man comics?
Superman?
Oh no, nothing like that, kids.
They're just kidding, Miss Barman. Right, guys?
Oh yeah, just kidding.
Thank you, Beatrice, for your help. Please, kids, let's go to the classroom and start working on some of this cardiovascular system.
Okay,
Bye,
bye,
Miss
Miss
Barman.
Barman.
Bye,
Enjoy the library.
Thank you.
So Dr. Fuentes, what was that emergency you had yesterday?
Did somebody have a heart attack?
Yes, I have a patient in the emergency room at Herman Hospital. And by the way, I was having an acute heart attack. It was a young man with severe chest pain.
So, he survived the surgery?
Yeah, he's doing very well. He improved markedly.
Wow, this is a cool classroom.
Yeah, I like the computers.
Well, let's review some of the things that we did yesterday. Yesterday we talked about cardiovascular disease, how someone has a heart attack, what happens when someone has a clogged coronary artery and how much damage they may have. And then also we talk about something else, what's a stroke. You know, a stroke now is called a brain attack. It's when someone has an acute damage to the part of the brain supplied by one of the arteries which go into your brain. That may occur to all people, young and old. Sometimes younger people may have aneurysm, rupture of those things, and older people may have blockage and clog on those arteries going to the brain. As well as many other different things that they can affect the heart, such as congestive heart failure. Hypertension sometimes could be a problem because the heart needs to stress in order to overcome this high pressure. And there are other things which will damage the heart if we are not careful with. Well, today we are going to emphasize mainly prevention and treatment. And I will show you something. Today we are going to discuss treatment and prevention of cardiovascular disease. And we can divide the treatment and prevention in three different modalities. The first one is behavior modification. The second one is going to be drug therapy and intervention. And the third one is some form of surgical intervention. Let's start with the first one, behavior modification. There are many things that people can do and you can do in order to have a heart-healthy lifestyle. And how you do a heart-healthy lifestyle, you can do that very well just eating the proper diet. What is a good diet for you? Diet reasonably low in saturated fats and high in fiber and fruits and vegetables. The other thing that you can do very well is increase the amount of activities. Lack of exercise, as we discussed the other day, will increase the cardiovascular mortality almost twice in relation to those people that they exercise very well. The third thing that we can discuss is other characteristics. For instance, if you are a smoker, you need to quit smoking. Smoking cessation is very, very important in order to reduce your risk of cardiovascular disease. Let's go now to an area of things that we can do in relation to medication. There are medicines that you can take in order to reduce your cholesterol. For people that have severe hypercholesterolemia, the best thing to do is to take medicines such as statins or niacin, which will normalize their cholesterol. This is by itself may not work, but in association with a good diet, a heart-healthy diet, that may be an excellent therapy. The next thing that you can do is you can exercise. Exercise reduces cardiovascular mortality at least twice. And remember, this should be part of the overall program of medication and behavior modification. Let's talk about one of the surgical interventions that we can do, and this is bypass surgery. Bypass surgery is a surgical technique in which an artery is bypassed by a vein or another artery in order to increase the blood flow to the distal portion of that particular artery. There are different types of bypass operation and different methods of doing it, but most of the time it includes the harvesting of one of the arteries, which is, or one of the veins, which is placed in the coronary arteries and sometimes goes from the aorta into the distal portion of the coronary artery. As you can see very well here, we have one of the harvested vein, and this vein is taken from the patient, which is going to be attached to the native coronary artery. Here in this second graph, you can see already the vein, which is very close and is being sutured into the native coronary artery. This procedure is reasonably safe and is very well tolerated by most of the patients that they have multiple coronary arteries involved with this clogging of the arteries, also called atherosclerosis. The other procedure which I want to tell you is so-called angioplasty and stent placement. This is a modality which is an intervention which occurs usually when the patient has clogged coronary arteries, like the one that we have seen before. And the procedure is very simple. What we do is we advance this balloon catheter into the arteries which supply the blood to the heart. Those are the coronary arteries. And when we advance the balloon through this clogged artery, we dilate the balloon at a particular point and reduce the amount of narrowing or blockage of this particular artery. As you can see in this graph here, there is the placement of one of the stents, which is a metallic mesh, which is placed inside the artery of those patients with disease. Those they are very useful techniques when someone has an advanced disease. They can help them, and usually those arteries they remain open for a long period of time. On occasion, maybe 10 to 20% of the times, those arteries may clog again, even in the areas where the patient may have had a stent or angioplasty. On the other hand, you need to be vigilant to make sure that the patient don't develop new symptoms or new episode of chest pain or discomfort, which will be the sign to us that the patient may be having some complication or some problems in those arteries in which they have had a procedure. Now that we have talked about this behavior modification, the next aspect is to talk about medications. Do we have medicine that they are really helpful in controlling different things, different risk factors? We have hypertension, and hypertension is an increase in the pressure inside the vessel, against the wall of the arteries. Hypertension usually may cause significant problems, not only for your heart, but also for your brain. And the way to control that is not only to follow a diet which is low in salt, but is to take medication. The other things that you can use medication to control is blood clot, which they may form in the arteries or in the heart in different places. And simple things such as aspirin a day can be extremely useful to reduce the risk, particularly those people that have already coronary artery disease. There are other ways, including one extreme way, which is cardiac transplantation. Have you heard about the people that they donate their heart, and then this heart can be harvested and placed in a person who has had major heart damage and will not be able to survive without a new heart. This procedure is called heart transplantation or cardiac transplantation. And this is very important because many people, they are alive because of this particular procedure. It was great to talk about cardiovascular disease. It was great to talk about prevention and treatment of heart disease. And I hope you have a very good and heart healthy life and stay away from drugs, tobacco use, and some of the other things that they really can make an unhealthy life. Please continue with this heart healthy behavior, and I think you and your family will do very well. See you soon.